Good day, everyone. We are from Group 6. Alright, firstly, we will start with basic anatomy of larynx. So, larynx, which is also we call it as a voice box, it extends about 5 centimeters from the level of the to the 6 of cervical vertebra. It's like 5 cm here. And superiorly, it attaches to the hyoid bone and opens into laryngopharynx. And inferiorly, it is continuous attaches with the trachea. So pharynx is actually an arrangement of 9 cartilages, which we call the cartilages as hyaline cartilages, but except for the epiglottis. And all of them are connected by the membranes and also the ligaments. So we actually have two main types of cartilages, like we have 3 large and unpaired cartilages and followed by 3 pairs of smaller cartilages. As I mentioned just now, we have 3 large and unpaired cartilages. The first one we will be looking at is the epiglottis. Epiglottis is a leaf-shaped plate of elastic cartilage which actually marks the entrance of the larynx, followed by the thyroid cartilage. Thyroid cartilage is a large and shield shape of cartilage which is formed by the fusion of 2 cartilage plates at the midline, and we call the midline as laryngeal prominence. You can actually feel your thyroid cartilage externally as Adam's apple, and it is typically like larger in males than female due to the sex hormone. Then we will have cricoid cartilage. Cricoid cartilage is a ring-shaped cartilage and attaches inferior to the thyroid cartilage. Followed by the 3 pairs of smaller cartilages. The first one we can see is the cuneiform cartilage. It is located within the airy epiglottic folds but have no direct attachment on it, but it is actually adds to strengthen the folds. Followed by the corniculate cartilage. As you can see, it is a very small structure that actually articulate with the apices of arytenoid cartilage. Then the arytenoid cartilage. This is a pyramidal-shaped structure. It is a pyramidal-shaped structure that sits on the cricoid cartilage.
The superior opening of the larynx, the glottis, is guarded by a flap of tissue called epiglottis. Characteristic of epiglottis. Epiglottis is composed of elastic cartilage and is almost entirely covered by a taste bud containing mucosa. The epiglottis extends from the posterior aspect of the tongue to its anchoring point on the anterior rim of the thyroid cartilage. How it works? When only air is flowing into the larynx, the inlet to the larynx is wide open, and the free edge of the epiglottis projects upward. How it works when swallowing? During swallowing, the larynx will close to prevent swallow material entering lungs. Firstly, extrinsic muscles of the larynx pull the larynx upward towards epiglottis. Secondly, the tongue pushes epiglottis downward to meet it. Lastly, epiglottis direct foods and drinks into the esophagus dorsal to the airway. Fun facts. Did you know that epiglottis, also called as the guardian of airways, anything other than air entering larynx initiate the cough reflex to expel the substances. However, this protective reflex does not work when we are unconscious. Epithelium of larynx. Where we can find the epithelium of larynx? The epithelium of larynx is located at the superior portions of the larynx. What type of the epithelium it is? It is called as stratified squamous epithelium lines. In addition, Below the vocal fold, there is epithelium called as pseudostratified ciliated columna. It has cilia to filter the dust.
The next one is vocal cords. What is vocal cords? The vocal cords, which can be called as vocal folds or voice reeds, it is located in the larynx that is made up of two folds of mucous membrane, and it is controlled by the vagus nerve. What is the functions of the vocal cords? The vocal cords has three main functions. The first one is to prevent choking, and the next one is to control the airflow to the lungs, and lastly and mainly to produce sounds. When breathing, the vocal cords open to let the air in and out. But when producing sounds, such as when speaking, the vocal cords close and vibrate, thus creating a sound. Laryngitis. What is laryngitis? Laryngitis is the swelling of the vocal cords due to inflammation. When it is swollen, it vibrates differently, thus altering your normal voice. If the inflammation is severe, it is possible to lose your voice completely. Laryngitis can be caused by viral infections, vocal abuse, and also allergies. And that's all for our presentation. Thank you.